everyone. I'm Dr. Robert Wong from Division of Gastroenterology and Hepatology at Stanford University School of Medicine. Today, we're going to talk about a topic on patient-centric care approaches to individuals with primary biliary cholangitis. As you know, PBC is a chronic cholestatic disease associated with significant morbidity and mortality. Oftentimes, when we see and manage these patients, a lot of our focus is on addressing, monitoring, and managing the liver disease aspects, such as monitoring liver tests, alkaline phosphatase, and adjusting our management approach based on those parameters. While that's important, equally important is assessing patient-reported outcomes. These are becoming increasingly important and well-recognized measures of outcomes in patients across liver diseases, including PBC. Patient-reported outcomes, or PROs, are as what they are stated. These are patient-reported symptoms on how the liver disease affects a patient's day-to-day life and how it affects their functioning. For PBC in particular, this is particularly important because oftentimes it does align with their underlying liver disease, and it's oftentimes the most distressing part of their symptom management. For PBC in particular, a lot of the PROs that we oftentimes ask about are quality of life measures, fatigue, and particularly pruritus. How do we assess and understand the PROs that patients are dealing with? Well, there are a lot of different measures out there that many of you might be familiar with, including healthcare quality of life measures, different itch scores, things like the short form 36. While they're all useful and you can actually use any of them, one of the ones that I found particularly helpful is something called the PBC 40 measurement. And this is the tool that's specifically designed and validated in patients with PBC. The reason I like this measure is that it incorporates many different kinds of parameters that are important in patients with PBC. In particular, the PBC 40 captures 6 distinct domains related to fatigue, emotional parameters, social, cognitive function, general symptoms, and most importantly, or perhaps most prominently, itch. There's also other scores you can use for itch, such as the numeric Likert scale or the 5D itch score. But I like to use the PBC 40 because it's a one-stop shop that really captures all of these different domains that are important in PBC. How do you incorporate this into your practice? Well, the PBC 40 is a questionnaire survey, and it's pretty easy. It's been validated and tested and takes approximately 5 to 7 minutes for patients to complete. Oftentimes, this can be incorporated into your normal clinic flow, whether it's a questionnaire in the waiting room or some clinics have patients complete this as a pre-visit questionnaire before their actual visit. I find this extremely important and efficient so that you can review the PBC 40 questionnaire results and prepare your visit before the patient arrives. This is another example of a patient-centered approach and how we can utilize the answers from the PBC 40 to make sure we hear, address, and listen to patient symptoms and what is most important to them, along with reviewing the liver disease aspects that are also important for managing their underlying PBC. I like to use the PBC 40 together with looking at patients' labs and taking those things into account to really make a shared patient-centered decision approach on how to start medications, adjust medications, or alter the therapy that they are on to better manage their underlying liver disease and to adjust their patient symptoms. Particularly with pruritus, I'm sure many of you that care for PBC patients have challenging approaches to managing moderate and severe pruritus. This is sometimes often underdiagnosed and unaware because we don't have systematic ways of asking for pruritus. And that's why implementing things like the PBC 40 score allows us to really systematically address, understand how the impact of pruritus is on a patient's quality of life. This allows us to identify the severity of pruritus and really implement sequential step-up therapies to ensure that we're adequately addressing the symptoms of pruritus as well as the other PROs that patients are dealing with. This is a very important aspect of care, and I think it's a model that really shows the comprehensive, holistic approach that we should be applying to all our patients, especially to patients with PBC. This is another aspect that also allows us to implement multidisciplinary care. While a lot of us are solely focused on managing the liver disease aspect of it, the PBC-40 and different measures of patient-reported outcomes can help us identify other aspects of PBC and its impact on a patient's quality of life that may allow us to incorporate multidisciplinary members into the team, such as nutritionists, mental health professionals, dermatologists, rheumatologists, really identifying other individuals that we can add to the team to enhance the care that we provide to this patient. So really, in summary, I think the key takeaways that I would have from today's discussion is to identify and incorporate the patient-reported outcome measures that you find most useful and most easily implementable into your day-to-day practice. The second key tip is try to implement these into a pre-visit questionnaire so that these are completed and allow you to review them comprehensively before the visit, and also to help engage discussion during the actual clinic visit with your patient. And then third, I think this really enhances the patient-centered approach to managing PBC, and I think it allows us to overall improve the patient experience as well as the patient outcome, and really identify potential opportunities to implement multidisciplinary care. Well, thanks so much for listening, and I hope you enjoyed the key tips today on patient-centric care approaches to PBC. If you're interested in learning more or have any questions on this, I would direct you to the Chronic Liver Disease Foundation website to learn more about PBC. Thank you.